Okay, so we'll start off with indications and clinical use. So Luvox is indicated for depression. So fluvoxamine may be indicated for the symptomatic relief of depressive illness in adults. The effectiveness of Luvox in long-term use has not been systematically evaluated in controlled trials. Therefore, the physician who elects to use Luvox for extended periods should periodically reevaluate the long-term usefulness of the drug for the individual patient. And now we have some information here that it's indicated for obsessive-compulsive disorder. So Luvox has been shown to significantly reduce the symptoms of obsessive-compulsive disorder in adults. The obsessions and compulsions must be experienced as intrusive, markedly distressing, time-consuming, or interfering significantly with the person's social or occupational functioning. The efficacy of Luvox has been studied in double-blind, placebo-controlled clinical trials conducted in obsessive-compulsive outpatients. The usefulness of Luvox for long-term use, so in other words for more than 10 weeks, has not been systematically evaluated in controlled trials. Therefore, physicians who elect to use Luvox for extended periods should periodically reevaluate the long-term usefulness of the drug. Now, what about this medication in geriatrics, so patients greater than 65 years of age? So since there is limited clinical experience in the geriatric age group, caution is recommended when administering Luvox to elderly patients. So it can be used in the elderly, you just have to use extra caution. Now what about pediatrics, so patients younger than 18 years old? So Luvox is not indicated for patients below the age of 18 years old. And it says that there's more information in the warning section, which we'll get to. Now what about contraindications? So patients who are hypersensitive to this drug or any ingredient in the formulation would not be able to use it, so that would be a contraindication. Co-administration of Luvox with a monoamine oxidase inhibitor, including methylene blue or linezolid, would be a contraindication. So more information here about that. In patients receiving selective serotonin reuptake inhibitors, in combination with a MAOI inhibitor, or an MAOI, there have been reports of serious, sometimes fatal reactions, including hyperthermia, rigidity, myoclonus, autonomic instability with possible rapid fluctuations of vital signs, and mental status changes that include extreme agitation, progressing to delirium and coma. These reactions have also been reported in patients who have recently discontinued SSRI treatment and have begun treatment with an MAO inhibitor. Some cases presented with features resembling serotonin syndrome or neuroleptic malignant syndrome. So at least 2 weeks should elapse after discontinuing an MAOI before starting Luvox. Also, MAOIs should not be introduced within 2 weeks of stopping Luvox.